Hello, everyone. Thought I would jump on and take a minute to explain to you guys the basic experiment designs and the structures that your book reviews for those. I had a question about this and I want to make sure that you guys have some good understanding and examples of the types of studies that would be used in these designs. When you're looking at and remember, these are basic experimental designs. The point is to have a random group of participants, to randomly assign those to experimental and control groups. So one group that gets the independent variable and one does not. And then to measure the outcome and see if the dependent variable changes. So let's say, basic idea of a prescription medicine study. A group of participants who all have the same diagnosis, let's say depression, and they are randomly selected to either be in the control group or the experimental group over the course of 6 weeks. They are administered a certain type of therapy or counseling or medicine, and that is designed to shift their depression. We're going to see if it changes their depression. And then at the end, we're going to measure and see what the rates of depression are. That's a post-test only design. So we're going to take a group, randomly assign them, give them an intervention, half of them an intervention, the other half not, and then test them all and see if anything, to see what the levels are. That's great. But one of the questions would become then, well, how do you know that the intervention changed the depression if you don't measure it ahead of time? So depending on what you're measuring, it may be more beneficial to do a pretest-posttest design. So let's say we have the participants and randomly assign them to the groups. So you have the experimental group and the control group. You measure all of them first. Let's say we're going to use the Beck Depression Inventory to measure the dependent variable before we administer the independent variable. So again, let's say it's a prescription drug trial at this point. So we have a group of people who all measure in a certain range for depression on the Beck Depression Inventory. They're randomly assigned to an experimental group or a control group, and they are administered a medication for 3 months. And then they are given the Beck Depression Inventory again at the end of those 6 months, and they're going to see if there's a difference between the depression rates of the experimental group and the depression rates of the control group. When you have a pretest, you have something to measure the post-test against so that you can tell if there are any changes and tell if there are changes between the groups. Did the experimental group significantly decrease depression where the control group did not? If they both stayed the same or if they both decreased depression, then you can't really assign the change to the independent variable that was administered. And that's what these experiments tell us. Where it feels like it gets a little more complicated is when you get to the Solomon 4 group design. The Solomon 4 group design is set up to help us understand and determine if the pretest may end up changing the overall outcome as well. So let's consider a different type of study. Let's say that we're going to measure the anxiety levels of mothers after being told about after having an education class about what could possibly go wrong in pregnancy. Okay, so an education course about pregnancy preparation, but specifically looking at things that could go wrong and how to prevent those, and then measuring anxiety afterwards. Sounds reasonable, right? So if you did a basic post-test only design, you would take all of the participants, you would randomly assign them to 2 different groups. One group would have the education, one group would not, and then you would measure their anxiety levels afterwards to see whose anxiety levels were higher, if they were significantly different. But the question would be, well, what about even with random assignment? What about if those mothers were anxious or not ahead of time? What would you measure it against? So if you did a pretest design, then you would measure, let's say we use the Beck anxiety scale, and you measure anxiety ahead of time. Then you administer the class to half of the group, and you don't administer the class to the other half. And then you use the Beck anxiety inventory to do a post test. And perhaps there are differences, perhaps there's not. But in this case, what if the anxiety scale, what if being exposed to questions about anxiety before taking a class that might produce anxiety made people more anxious? That's where a Solomon 4 group design might come in. So what would happen is you'd get a group of participants and you would randomly assign them to 4 groups: an experimental and control group that would only receive a post-test, and an experimental and controlled group that would receive a pretest and a post-test. That way you would have 4 measures of outcomes to look at between each other. So not only would you be measuring the differences between the experimental and control group, those who received the education, those who did not, but you would also be measuring between the group who received the education and had the pretest and those who received the education and did not have the pretest. And this is what those results might look like. What it's going to show us is, does the pretest have an effect on the overall outcome? Let's pretend like this dependent variable here on a 0 to 8 is anxiety levels after or measured before and or after measured after the independent variable was administered. So in this case, that's psychoeducation. When you look at this outcome number 1 possibility, what you see is that in the post-test only group, so remember this post-test group who did not receive a pretest group, at the end of the study, the treatment group's anxiety, meaning the people who got the psychoeducation on things that could go wrong during pregnancy, their anxiety was higher than the post-test only group. And in the pretest post-test group, those who got the treatment, their anxiety was higher than those of the control group. That would tell us that there's no pretest effects, that taking a pretest about anxiety did not have any effect on the outcome of the experience of anxiety after having a psychoeducation class about what could go wrong during pregnancy. This is the other option of an outcome. This would tell us that there is a pretest effect. So perhaps we did this and we got the results back, and it said, okay, for those who got the post-test only, both groups, their anxiety levels were the same. The psychoeducation class didn't really increase anxiety in the treatment group. So learning about what could go wrong during pregnancy may be empowering, not scary, not anxiety producing. But in the pretest post-test group of this Solomon 4 design, those who received the treatment did have increased anxiety. So then we would say there is some indication here that looking at and exploring anxiety, measuring anxiety before you go into a test, maybe bringing some of those anxiety feelings to the surface and then going into a psychoeducational class, that pretest has an effect on that. So that's what you're seeing here is the Solomon 4 gives you an understanding of whether that pretest actually influenced the outcome of the study. If you only do a pretest post-test design, you can't determine whether that pretest has any effect over the outcome of the study. In some cases, it may not matter, but in cases like measuring anxiety, it could. If you have questions about this, please feel free to send me an email and I will respond. Y'all have a great week.